Over the course of the last year, year and a half, we've had a variety of studies that have taken a look at the optimal duration of dual antiplatelet therapy after drug-eluting stenting. The problem has been there's been a wide variety of answers to that particular question. And now we're taking a look at a high-risk population specifically. And reminder that we are at CRT, and if you would like to see the abstracts from this particular meeting, please go online and check out JACC Interventions. And I am here to introduce you to Dr. Abishek Sharma, who is a fellow at State University of New York Downstate Medical Center in Brooklyn. Now, in this particular case, we're talking about diabetic and non-diabetic patients.
Yeah.
Why did you decide to do this study, first off?
Yeah, Rick, as you know, that diabetic patient, they have a higher prevalence of coronary artery disease, and they account for more and more number of patients who underwent PCI. So this is a specific high-risk patient which have not been addressed specifically in the studies before. So we aim to look into the duration of DAPT in these patients. That was the reason we conducted this study.
So how did you do it? I mean, specifically, how many trials did you look at?
Yeah. So we look into the 8 trials, which have 28,300 patients.
Nice
and,
size.
Yeah, and we have 8,200 of diabetic and more than 20,000 non-diabetic patients. And they were randomized in a 1-to-1 fashion, less than 1 year for shorter duration, more than 1 year for longer duration DAPT.
Now, for those who are going with shorter, what was the length? Was it exactly a year, or was it for some 6 months, 8 months, 10 months?
So the studies that we have included in our analysis, the shorter duration varies from 3 months to 6 months. Most of them have 3 months, but some have 6 months too. So it's like any study which has less than 12 months considered as a shorter duration of dual antiplatelet therapy.
So what did you find?
So we found that initially we hypothesized that diabetic patients, because they're more prothrombotic, they have endothelial dysfunction and platelet activation and higher platelet activity than non-diabetic patients. So they should be benefited from longer duration. But contrary to that, we found there's no difference in the shorter duration DAPT and the longer duration DAPT in diabetic patient. However, in non-diabetic, the longer duration was better in terms of stent thrombosis, because shorter duration was associated with 3.67 times increased risk of stent thrombosis compared to shorter duration. Longer has a benefit in terms of stent thrombosis. However, there was none in diabetic patient, which was surprising because they have a higher platelet activity level. So one of the reasons we think it could be because diabetic patients have a higher baseline platelet activity level, and with current generation of DAPT, which is Plavix as a second agent in our case, that might not be enough to decrease the level of platelet activation. So we might need a more potent and more effective antiplatelet therapy in diabetic patients.
So what's your take-home message from this? What did you learn from the paper?
So I learned from this paper is that this relationship is very complex in diabetic patient and the duration of antiplatelet therapy. And as of now, with current data available, though the theory and the rationale tend to favor the longer duration DAPT, but the data as of now does not favor the longer duration of DAPT in diabetic patient particularly.
So you're doing anything else with this, or is this, do you think you've answered your questions?
No, I think I haven't answered my question completely. It's still in the part, and I'm looking forward to specifically study the more potent antiplatelet therapy in diabetic patient, as I said, because they might benefit for something stronger or something more potent than Plavix itself as a second agent.
Well, we want to remind you that we are at CRT, and if you're looking for the abstracts, please go to JACC Interventions, because that's where in the February 22nd issue they have a supplement containing all of the abstracts from this meeting. For CardioSource World News, I'm Executive Editor Rick McGuire.